For those of us that don't have a background in health administration, getting onto the wild, wild web, there's so many voices, any condition, and I'm going to get 15 different opinions about what really caused it. What is your advice for vetting the sources so that you know you're getting education that's going to be helpful, that's valid? What do you look for markers of, okay, I can trust that this isn't written by Bob in his mom's basement all by himself in a vacuum? How do I know that as a consumer?
It's a great question. And I get that from friends, family, highly educated people. It's very overwhelming because there is this big, expansive web of information now. So it's about trusted sources and knowing which are trusted sources. It's also about not using Google to be your doctor. Using
Right.
Google for information to inform. So when you ask the doctor questions, you're knowing what you're asking and you're knowing what you need to know more about. The main trusted sources are any academic medical center that specializes and has a whole department of teaching, research, and patient care on a particular subject. And most large academic medical centers have these departments, whether it's cardiology, thoracic medicine, dermatology, oncology, hematology, all the things that I would start with. Who are your local big academic medical centers, and going on and seeing if they have departments and seeing if they do research. And then the second tier would be disease-specific websites that are created by associations. Who's doing the most research on this topic? But
Right.
also the major disease categories, they have a lot of information. For my disease category, myeloproliferative neoplasms, over 20 years ago, there wasn't that much available, but there was a very newly launched organization, the MPN Foundation. And they put a lot of effort into patient education and tier programs and explaining who was doing the research on this topic. Overall, it was really scary because there's no cure for the disease and
Right.
it progresses in different ways for different people. But it was comforting to know that you weren't alone and that you look at other people, what they did to improve their quality of life and what doctors they used. And it's a national organization with international ties. So for me, it was a great source of information and comfort and knowing who really the most noted doctors were who were doing research in this field.